It's a new option, but an old approach. Dr. Gregory Miranda joins me. He's pediatrician next door. Good morning, Dr. Miranda.
Good morning. How are you?
You are doing something that most people think was left in the past. You make house calls.
I do.
Now, how did your practice evolve to doing almost exclusively house calls?
Really just exclusively house calls right now. And, you know, I think I've had this idea for a while, but it was, as I spent more time in the Vail Valley, I realized that perhaps people would appreciate having a doctor who does house calls.
And what drew you to pediatrics?
Well, I think it was in medical school I first became interested in helping kids. And, sorry, I'm just a little bit nervous.
Oh, that's all right.
Really, it's always been about kids for me. I want to make sure that they're as healthy as possible and provide the best care that I possibly can for the parents and the kids themselves. And it just felt natural. I'm
just wondering if you have to do a little bit of sleuthing, because perhaps an adult may tell you too much information or information that's not necessarily helpful, but it seems to me kids maybe not able to articulate what is going wrong or what's upsetting them.
Right, you're right. It's a little bit harder with kids sometimes, especially the very young ones. You start with the vital signs, and when I do a visit, I do all the vital signs myself. So it's me, hands-on with the kids, and I'm observing everything that they're doing, and I think that makes it a little bit more personalized experience, and I get to do all that sleuthing in it's real time. There's not a triage nurse, there's not a technician who's doing something. It's just me, and so a little bit of detective work.
Do most of the time you get a sense right away from the vital signs of what the problem might be?
Yeah, they're called vital signs for a reason. It's key for sure. If there's a fever, if the heart rate is too high. One of the first things I do often is when I first walk into the home or the hotel room, wherever I'm seeing the patient, I'll see how the child's breathing. And they might be sleeping, they might be playing, but if I see they're breathing fast, then I know, well, maybe I need to worry about lung infection, or could they have altitude sickness, which is really common here. And so it's a great place to start, just looking at the child and seeing how they're breathing, and then moving on with the rest of the vital signs from there, and just whatever order makes sense.
Well, I kind of grew up in an old school sort of household. My dad sort of thought we had to have one foot in the grave before he was going to engage medical intervention. But what are some of the signs a parent should be looking for that maybe the problem is more serious than they think?
Yeah, a few things. Kids get dehydrated pretty quickly, and so if they're crying and they don't have tears, or if they have a sticky mouth or they've stopped peeing, those are some things to worry about. Fever frightens a lot of people and kids, but it's not the scariest thing to me. I certainly pay attention to fever, and I want to treat it and make the kids feel better. Just for instance, if a fever has gone on more than 5 days, that's very unusual, but
okay.
Even 2, 3, and 4 days of fever, that's pretty typical for common childhood illnesses. And then, as I mentioned, the breathing, you have to watch your kids' breathing, especially if you've come from low elevation here to Vail. The risk of having some kind of lung problem related to the elevation change is much, much higher. And I've seen lots and lots of kids and adults who need oxygen just because they're here.
Yeah. So how do someone engage your services? How do we find you?
You can call me, and I also have a website set up. It's pediatriciannextdoor.net. And there's a form on the page where you can actually request an appointment, and those requests come right to me, and I try to set something up. And certainly the phone is, I actually talk to a lot of families on the phone before I go see them, or if we're deciding what's the best course of action, and get a little bit of information there.
Well, Dr. Miranda, thank you so much for coming on our program today. It was great talking with you.
Thank you for having me. Great.
That's Dr. Gregory Miranda. He's the pediatrician next door. Stay tuned. Coming up, we've got your weather forecast.